Good morning, members of the committee. My name is Greg Hansch. I work as Policy Coordinator for the Texas chapter of the National Alliance on Mental Illness, also known as NAMI Texas. I'm testifying in support of House Bill 3376. NAMI Texas has 27 local affiliates throughout Texas and nearly 5,000 members made up of mental health consumers, family members, friends, and professionals. Our purpose is to help improve the lives of people affected by mental illness through education, support, and advocacy. I appreciate the opportunity to speak with you today. Many uninsured individuals are affected by mental illness but do not receive any treatment. 13% of those without insurance in the U.S. have been diagnosed with a chronic mental health condition. Because uninsured adults are more likely than those with insurance to have an undiagnosed condition, it is likely that the actual rate of mental illness among the uninsured is higher than 13%. Among the uninsured with a mental health condition, 39% report a comorbid chronic physical condition as well. Individuals with mental illness also commonly experience difficulty accessing private insurance through the employer-based market, as mental illness is linked to lower employability. Access to mental health care is far better under Medicaid than it is for the uninsured population. Around 90% of Medicaid beneficiaries with mental illness report that they have a usual source of care, in comparison to 60% of uninsured low-income adults. 12% of those on Medicaid and 46% of uninsured adults have gone without a checkup in the past year. The uninsured are also 4 times as likely as those on Medicaid to report being unable to access needed care. It is clear that Medicaid is a critically important component of the state's mental health treatment system, but that there is a large unmet need that is directly related to lack of insurance. House Bill 3376 would open access to Medicaid for eligible populations under federal law. This presents not only an opportunity for the state to drastically improve the quality of life for individuals with mental illness by expanding access to health insurance coverage, it would also help city and county governments reduce emergency room, jail, and prison costs associated with untreated and undertreated mental illness. By drawing down federal dollars to support expanded access to health insurance coverage, we would be easing the cost burden on the local governments that are forced to pay for uncompensated mental health care. The state's contribution to opening access to Medicaid would never be more than 10% of the federal government's contribution. Additionally, independent analyses have shown that for every dollar Texas spends on opening access to Medicaid, the state would receive $1.29 in dynamic state revenue over the first 10 years of the expansion. In light of the positive impact that House Bill 3376 would have on our state's economy and on access to mental health care, NAMI Texas and our 27 affiliates around the state strongly encourage the members of this committee to vote in support of the bill. I appreciate you for your time and would be happy to answer any questions.
Thank you for being here, and there is good news out of Dr. Zerwas's committee. There is substantial increase in funding for mental health, so I think all Texans are happy about that.
We're thrilled about it. Thank you very much.